Good afternoon, everyone. This is Stephanie with Radiance Medspa, and I see that most of our participants have had an opportunity to plug in here, so we're going to go ahead and get started. I'm going to put my face on the screen just for a moment to say hello and kind of get this kicked off, and then I'll turn my video off and we'll focus on the slides. But hello, everybody. I am Stephanie Schlageter, and I'm the founder and CEO of Radiance, and I'm going to be conducting the webinar today. Before we get started, I always like to cover just a few housekeeping items. It's 1 p.m. and we will try to stay on a prompt or tight time schedule today. We know you guys most people are plugging into the webinar during a busy day. And so my goal is to walk through and complete the presentation in about 45 minutes or less to allow for a few minutes of Q&A at the end. And with regard to Q&A, please take a moment to find the Q&A chat box. Either it's at the top or the bottom of most people's Zoom screens. That Q&A box is a really handy tool. We like to use that for anyone who would like to submit questions at any point during the presentation. And we will be reading through those questions and answering them at the end of the presentation. So if at any point during the webinar you have a question or something you'd like to submit, please don't hesitate, and we will get to those questions at the end of the program. So please use that chat whenever you feel compelled to, and I'll remind you at the end of the presentation as well when it's time for taking those questions. So without further ado, I'm going to go ahead and turn off my video. I'll see you at the end, and go ahead and dig into the presentation. So let's go ahead and get started. So the subject of today's webinar, as you all should know, is, sorry, it always has a little bit of a delay getting started. I apologize. Sorry about that. Technology, there we go. Okay, sorry about that delay. So the subject of today's presentation is SkinTight Laser Resurfacing. And this is actually a combination therapy that I'm going to walk you through what that means throughout the presentation. But very popular in our industry in this day and age is combining different modalities to get the best results for our patients. And the combination of modalities that makes up SkinTight is really, really incredible. It can accomplish definitely the sum is better than the individual parts by themselves by far. And we're going to talk about that through the presentation. So this combines several different treatments and modalities to get the very best skin resurfacing out of the technologies that we have. So again, that's me. You just saw me live, and I am the founder and CEO of the business. We founded Radiance in 2006. We are just on the verge of celebrating our 15th birthday on April 3rd. So very excited to have a successful business in the local community for 15 years now. And that's something we're looking forward to celebrating. We are staffed by a team of experienced, trained medical professionals. I know I can see the participant list on the Zoom here, and I know many of you know our medical professionals quite well. So you have a great appreciation for their professionalism and their experience. Our specialty is non-surgical cosmetic procedures. So everything we focus on is non-surgical. So either non-invasive or in some cases minimally invasive, but no surgery, all with minimal downtime, little to no risk, and beautiful natural results. And our mission as a business is to help you look and feel great inside and out. We think it's a fortunate mission to have, and it's a lot of fun living by that mission on a daily basis. This slide just details some of our experience, just to hopefully build trust and confidence in us by you. We have over 15 years now, well, going on 15 years in a couple weeks, of aesthetic laser experience. We had lasers from day one when we opened our business. They've always been a very important part of our service offering. And you'll see in another slide, we've literally had, I mean, generations after generations of different laser technologies over 15 years. So we are very happy to say that we have formidable experience in this area so that you can trust us to give you a safe and effective procedure. We're not going to talk about cool sculpting today, but it's listed on this slide just because we rank top 5% of all cool sculpting practices in the nation. We also are the #1 Botox facility in Pinellas County. We are the #1 Juvederm facility in the entire state of Florida. So we do lots and lots of those two treatments as well. We are on the list of Inc. 5,000 fastest growing companies in the United States. That's among small businesses, and Clearwater Regional Chamber's Business of the Year. So just some accolades that we like to share, not to brag, but just to build confidence, because we think in our business, it's really important that you know you're dealing with somebody who is reputable, established, experienced, and knows what they're doing. So this is a list of our services. Many of you are already familiar, but some people we find are surprised to learn that we do certain things that they just didn't know we did. So I always like to take the opportunity to go over quickly the overall list of our services. At the top here is our skin tightening and skin resurfacing services. And actually, the combination of these is what we're going to be talking about today. We call it SkinTight Laser Resurfacing, and it essentially is the combination of VIVACE and CoolPeel. And we're going to put it all together in the next few slides. But we do other skin resurfacing treatments and other skin tightening treatments. We just do a whole variety of things in that category. You'll see at the end of the presentation why SkinTight, the combination of VIVACE and CoolPeel, is so wonderful and beneficial. But we do a whole host of body contouring treatments such as laser liposuction and cool sculpting. We do Botox and Juvederm, as you probably all well know. We use PRFM, which we're going to talk about today as well, but we use it injected into the scalp to regrow hair in people whose hair is thinning or falling out. We do a whole host of facial treatments, including peels and hydrofacial treatments. We have a vast offering of medical grade skincare products, and we offer complimentary consultations to help people figure out which of all of these wonderful things is right for them or right for you. So in terms of our laser experience, because that really starts to hone in on what we're going to talk about today, we have completed more than 25,000 laser treatments over the last 15 years. And that's actually kind of a conservative low number. But in 15 years, we have treated thousands of patients, many thousands of times. So you can trust in our experience there. Our medical staff are all certified laser providers. That is not, unfortunately, a regulatory or legal requirement in the industry, but we at Radiance think it's very important to have certifications for laser treatments. And so we maintain certifications for all of our providers on an ongoing basis, which is just an important investment we make. And I do emphasize that because not a lot of medical practices make that investment because it is expensive and takes time, but it does ensure that our providers are knowledgeable and safe in the operation of lasers. Dr. Francis, our medical director, is a board certified physician with special certification in aesthetic lasers. She personally has experience, more than 13 years of experience herself performing aesthetic laser treatments. And so overall, with lasers and skin tightening combined, we have more than 14 years of experience. So we've been doing some combination or individual of each of those treatments since almost the day we opened. We added skin tightening about a year after we opened, and we've done lasers since the beginning. And as I said earlier, we have experience with so many generations of technology. I mean, I often say to people, if you can name a skin tightening or laser technology, we have offered it over 15 years. So we've got a lot of that to bring to the table as well. And we are an industry leader. We like to really keep ourselves at the cutting edge of the latest and greatest technologies. We think that's really important because you, our patients, want to know that you're getting the very best, latest and greatest offering in our industry. So that's an important thing that we uphold as a business. really great thing about the treatments as they get better and better over time is they are less invasive with less downtime, yet more impactful and more even more impressive results. So that's essentially what we're going to talk about today, is the latest and greatest ways to resurface your skin, improve your skin with minimal to no downtime and minimal to no side effects, risks, or anything in those categories. So it's really amazing what continues to happen in our industry. So SkinTight Laser Resurfacing, what is it? It really is a combination of things that we put together to get you the best results. It's a novel combination of 5 state-of-the-art treatments in one. And by the way, this is an internal Radiance branded combination of treatments that you will not find anywhere else. Yes, there are people who combine skin tightening and laser treatments or microneedling and topical treatments. You'll see lots of different combinations of these things out in the marketplace, but this is a unique combination of these 5 things that we, over years of experience, have put together to get you the very best results. So we're going to go through these one at a time, and I'm going to explain to you how each one of them works and what it does for you, with the culmination at the end of, pictures and explaining to you what overall results you can expect from this combination of treatments. So radiofrequency skin tightening is one component. Microneedling is another component. Laser resurfacing with a CO2 laser is a third component. PRFM, which stands for Platelet-Rich Fibrin Matrix, topical application, is the fourth part of the combination. And then we send you home with a kit of really important medical grade skincare products that finish your treatment over the weeks at home after the treatment is done. So those are the 5 treatments that we combine into one and call it SkinTight. Okay, so in terms of steps of the treatment, there are also 5 steps essentially, and we'll go over this at the end when we get into like the actual procedure details, but there are 5 steps to the treatment. One is we numb you. The second is we do the VIVACE radiofrequency microneedling. That's the name of the machine that we use that does the radiofrequency and microneedling. Step 3 is the laser that is called CoolPeel. Step 4 is applying the platelet-rich fibrin matrix. And step 5 is you finishing the treatment at home with the products that we send you home with. And again, these are all the very latest in combination therapies in our industry. So let's get into it. So what is radiofrequency skin tightening? Radiofrequency skin tightening, which comes in many branded names, by the way. Some of you may have heard of thermage or Ultherapy. There are a vast number of tightening treatments out in the market. Skin tightening with radiofrequency has been around for over 20 years. And it basically, in the simplest sense to describe it, it delivers electrical energy through the surface of your skin, deep down into the dermis, where that electrical energy generates heat. And the heat causes damage to your collagen and elastin. And this little skin slice over here shows just the epidermis on the surface. And then you have your dermal thick layer here. And these electrical energy devices like radiofrequency basically have the ability to just drive thermal energy deep into the dermis. So you get this really nice thick layer of thermally treated skin. What that thermal damage does is it causes your collagen and elastin to regrow new, your body will regrow new collagen and elastin in response to the damage done by that heat. It's just that simple. So this is a proven technology, proven concept, been around for a long time, definitely here to stay. And it does a really great job of generating lots of collagen and elastin over about 3 to 6 months. That's the healing time for most people, producing results that are tighter, firmer, and lifted skin. I'm going to show you pictures, so hold that thought, but totally non-invasive, no downtime whatsoever with radiofrequency. Long-lasting results, because once you develop all new collagen and elastin, it's like you have a new start. So the better, the process just begins again and you start aging again. So it's not ever, nothing unfortunately we ever do is truly permanent, but these results should last for many years before you have to do something like this again. So very long lasting results. And when we think about tightening the skin with radiofrequency, we think sagging jowls and neck. We think deeper facial lines that are caused by sagging. Okay, so think about sagging and loose skin when we talk about radiofrequency. So that's part one. And I mentioned these. We used to do thermage from pretty much right after we opened. We opened the business in 2006, and by 2007, we had our first skin tightening device, thermage. We did that for six, 7 years before we upgraded to ultherapy. We then did ultherapy for about the same amount of time, and then we upgraded in about 2018 to VIVACE. So we've had VIVACE for a few years now. Very successful addition. It is a form of radiofrequency like thermage was back then, but it added this very essential additional technology to it, which is microneedling. So VIVACE essentially is a single device that combines radiofrequency with microneedling. I'm going to show you a picture here in just a second. So see this picture up in the upper right? So this is the VIVACE handpiece for those who have not seen it before. And the end of this gets applied to the skin, and it pulses electrical energy through these little needles as soon as the needles are pressed into the skin. So these little needles automatically kind of plunge into the skin, and at that instant that the needles are in the skin, the electrical energy gets driven through the needles into the skin, delivering that heat. So really, the VIVACE machine does two things. It uses microneedling, which is the insertion of little needles into the skin, and delivers radiofrequency heat all in one step. And so basically imagine this being pulsed, one pulse at a time, all over the face, neck, or chest, or hands, wherever we're treating. So the benefit of the microneedles is that not only does it cause physical damage, so every time a needle gets inserted into the skin, it's actually physically causing damage to the skin, which promotes healing and replacement with new skin. But it also, those little needles also create microchannels for deep delivery and absorption of topical agents. And we're going to talk about this PRFM. I've mentioned it a couple times already, but we're going to talk about this in a moment. It is a topical treatment that we put on after the treatment's over. And by VIVACE making those microchannels, that PRFM, that topical treatment, gets absorbed deeply into the dermis and has just hugely beneficial effects. So not only do the microchannels, the needles cause damage that causes healing, but you also get this really nice open skin opportunity to deliver the PRFM, which again, hold the thought, I'll tell you what PRFM does in just a moment. After a microneedling treatment or VIVACE treatment, healing starts immediately, just like your body starts healing from a wound right away, and will continue to heal over about 3 to 6 months. Pretty much you're going to get the gist of this, but the human body, when it comes to the aesthetic types of treatments that we do or we're talking about today, typically will take about 3 to 6 months to fully regenerate and produce the final results from the treatment. The results from doing microneedling type treatments are smoother textures of the surface of the skin, scars, whether they're acne scars, surgical scars, things like that, respond really well to microneedling, and it can help even out your skin tone. So any dyschromia or unevenness of skin coloring really can be blended with these treatments as well. As I said earlier, not only do you get collagen and elastin reproduction, but we put this PRFM on top, and that really boosts additional collagen and elastin. This is a minimally invasive procedure, just these little microneedles go into the skin. There's no bleeding, there's no open like wounds afterwards. Those channels stay open for a short time, just long enough for us to get the topicals in there, and then they naturally close up. They're just these tiny little microchannels. Again, very long lasting results from treatments like this because they are generating new collagen and elastin. So again, ideal for rough texture, scars, uneven skin tone on the surface. Think of that. So far, we've kind of talked about the radiofrequency and microneedling part of the treatment. And I now want to quickly summarize the third part of it, which is the laser resurfacing part. And please take note, this CO2 laser resurfacing, this is an old technology that's been around for a long time, but what's new is this CoolPeel version of CO2. Many of you have probably heard about CO2 laser resurfacing. It's literally been around for 20 plus years in our industry. Older CO2 lasers were they're still around, but they're very aggressive ablative laser treatments that literally leave patients, the old ones did, leave you with massive downtime, like 2 to 3 weeks of raw, oozing skin, high risk of infection, couldn't really leave the house for a couple of weeks. I mean, it was a pretty rough thing to go through. Beautiful results for sure, but really challenging for patients to go through those treatments and to deal with all the downtime. Plus, if you didn't take really, really careful care of the skin, there was a lot of incidents of infections and getting on antibiotics and things like that. So fast forward to modern day, the new CO2 lasers are much, much different than they used to be. The CoolPeel is called CoolPeel because it is a very precise, minimal downtime version of a CO2 laser. It is still a CO2 laser. It still produces amazing results, but it's done in a series of treatments to minimize downtime. And the precision delivery of the energy is so much more controlled. So patients just simply do not have the raw oozing skin type of downtime that they used to have with the older CO2 lasers. So again, it is CO2 results, but without the CO2 downtime or risks. And that's what CoolPeel is all about. Very powerful laser, but very precise. It ablates the surface. What ablate means basically is to vaporize. So when we pass this laser, as you can see in the picture, across the surface of the skin, it's literally like ablating or like vaporizing or clearing with laser energy the very superficial top layers of the skin. Those little, it's done in spots, by the way. You almost can see in this picture, there's little tiny dots. It's called a fractional laser because instead of clearing the entire full thickness of your skin at once, which is what creates the massive downtime, it just scatters the skin with little dots of damage. So those dots will heal very quickly. They're surrounded by untreated tissue, and that is what really helps minimal downtime, minimal risk, and faster healing. So the heat from the laser also dissipates throughout the surface of the skin. So you get really nice superficial tightening and collagen and elastin remodeling. So keep in mind VIVACE, which I talked about earlier, goes really deep. It goes all the way into the dermis. Lasers just treat the very surface. So as we start to put these technologies together, I want you to start appreciating that VIVACE goes deep and the CoolPeel goes superficial, and together they really produce this combination full thickness tightening and resurfacing of your skin. So we'll keep building on that, but I just want to start putting that picture together for you. The results with the CoolPeel, again, we're on the surface here. So think of things that you see on the surface, fine lines, wrinkles, you get a little bit of surface contraction or tightening. So like crepey skin on the surface will tighten up nicely. It can also help improve some deeper lines and creases. I'm going to show you some pictures of good candidates for these things. But like some people have smile lines in their cheeks that are kind of etched deeper lines in their cheeks. For that, we usually want to bring a laser into the mix, and that's where this comes into play. Again, totally non-invasive, minimal to no downtime with this, which is truly amazing. And again, very long-lasting results. We're using these energy sources to develop your own new collagen and elastin. So again, ideal for fine lines and wrinkles, deeper lines and creases, crepey skin. Think of surface conditions. So that is the laser portion. Now I want to explain a little bit more. I've referred to it a few times already, what this PRFM is. And just for reference, many of you may have heard of PRP. PRP's been around for several years now. We used to offer PRP, again, in our interest of always offering the latest and greatest technology. We recently, about a year ago, upgraded from PRP to PRFM, which is just the more advanced version of PRP. What PRP and PRFM are basically is your own blood sample drawn on site. We take a tube of your blood as pictured here. We spin it in a centrifuge, and the centrifuge basically separates out your red blood cells from the plasma, which is this clear yellow looking fluid. The plasma in your blood, by spinning it, it becomes this very concentrated solution of cytokines and growth factors from your own body. We then use just the plasma part of it. We draw it out into a syringe, and we then topically apply it after your treatment, which then delivers your body's own really concentrated solution of growth factors and cytokines to help really give a boost to that collagen and elastin remodeling. The cytokines also, those are healing cells in your body's blood, and really helps minimize downtime, inflammation, redness, swelling. It's really like the perfect topical treatment after VIVACE and CoolPeel. It's just amazing. So after we do the combination, the SkinTight combination, the next step is we apply your PRFM to the top of the skin, and it gets absorbed through all those little microchannels. And keeping in mind also that we've just ablated the surface of your skin. So there's all these little dots of fresh, open skin from the CoolPeel as well. So you just have this really open matrix on your skin that's just ready to absorb the PRFM. So we tell you to leave it on for the rest of the day, and basically wash it off the next morning, and it will absorb and do its thing. And then the skin closes up and starts healing, and you're off and running. The PRFM part of the treatment, by the way, I just like to mention, is automatically included in all SkinTight packages. So, but it is an important step in the process. This slide I just like this slide. It's a little, maybe more information than you need, but I think it kind of summarizes and highlights visually a lot of the things that I just talked about. So there are many different technologies listed on here. Today, we're talking about the CoolPeel combined with the VIVACE. These are other technologies that we also offer. They all kind of do different things, and I don't want to get, too busy in this webinar today, try to keep it simple, but it kind of shows you a progression of deeper and deeper technologies that we offer. And you can see that the CoolPeel on the surface treats the superficial epidermis. We can crank the energy up a little on the CoolPeel so that it goes all the way through the epidermis, which is what we usually do. And then the VIVACE, you can see, goes significantly deeper. It is, of all the technologies we offer, it is the deepest delivery of energy, both needles and that thermal energy. So just imagine you get this first, you get this really nice deep delivery of energy, you get the mechanical damage caused by the needle, and then we finish off by treating the surface skin with the energy of the CoolPeel laser. So these others in the middle will be subjects of different webinars if you're ever interested, but and we can always talk about them with you in a consultation too. I just don't want to complicate it right now. So the last part of the whole process is sending you home with very specific, very important topical medical grade skincare for you to use at home. We give you very explicit instructions, but basically it looks like this. The products are all included in your package. They are critical for safe and optimal healing and best results. And it basically looks like this. For days 1 through 7, you're going to use the cleansing complex. These are all IS clinical products, which are really made and designed for post-treatment skincare. So they really do produce the best results and keep your skin protected and safe after the treatment. The cleansing complex is a very mild cleansing complex. Shield is a protective barrier with some soothing components to it that really help soothe the skin. And of course, you need a really good SPF that has no chemicals, is pure mineral, and has at least a 50 SPF. So days 1 through 7, it's pretty simple. You're just using those products. Days 8 plus, once your skin is healed a little bit more after a week, you can add some serums, some moisture products, and we strongly recommend this Skin Medica product, which has topical growth factors and some other really great antioxidants and things like that. So I don't want to get too much into detail for time's sake today, but we do have a very specific regimen that we put you on. Again, all of which is included in your package. A complimentary consultation is really necessary to establish, what your skin concerns and goals are. Are you a good candidate? We do a review of your medical history to make sure you're healthy and in appropriate shape to have the treatment. We just really want to make sure you're currently healthy, you heal well. We're going to be delivering a lot of energy and doing a lot of treatments to your skin, and we want you to have a really robust result. We really want to spend time discussing realistic expectations. That is the secret to success with our treatments for anyone. We talk about your schedule and timing. The SkinTight treatment is always a series of 3, and they're done 30 days apart. It doesn't have to be exactly 30 days apart, but we strongly recommend that you try to get on a schedule to do each treatment about 30 days apart so that you get your full results in a reasonable amount of time. So we talk about schedule and timing in the consultation as well. We review all pre and post treatment instructions with you, which I'm going to go over next, just a brief summary, and then we give you pricing. So if at the end of this webinar today, you're interested in possibly getting this treatment, our next suggestion, our step for you would be to book a complimentary consultation. So we'll talk about that in a moment. Just a few pre-treatment and post-treatment considerations. Pre-treatment considerations. Do keep in mind that everybody's a little bit different. These are minimally invasive and minimal to no downtime treatments, but the typical post-treatment experience for people is a few days of looking like you might have a mild sunburn. Some people get a tiny bit puffy, like just a little bit of swelling, and your skin is going to be sensitive for a few days. So you always want to plan for that just for the first few days before you book. No sun, absolutely no sun. This is very important for 2 weeks before your treatment or 2 weeks after. So of course, Florida, gotta be real careful about sun planning before and after the treatments. If you are prone to hyperpigmentation or a high-risk skin type, which we can define for you in a consultation, you really should pre-treat with topical pigment suppressors. We will give you IS Clinical's Brightening Complex, which suppresses pigment production pre-treatment so that the heat and the lasers of the treatment do not actually stimulate the production of brown spots on your skin. So that's something we talk about in a consultation. Not everybody has to pre-treat, but we know who you are and we will tell you if you're one of those people. So we do want you to discontinue medical grade skincare products a week prior. That's like your glycolic acid, alpha hydroxy acid, any medical grade antioxidants, things like that, that might irritate the skin. We don't want your skin to be irritated before you get the treatment. If you have a history of cold sores, we will provide a prescription for antivirals for you, and we cannot treat on or near an active cold sore. As I said earlier, we want you to be healthy and a good healer at the time of treatment. No other treatments can be performed on the same area for 4 weeks afterwards. So that's also something to keep in mind in case you had other treatment interests or plans. It's always a series of 3 treatments. So you kind of want to look at your calendar and plan all 3 treatments when you're looking at doing this. And do anticipate 3 to 6 months of healing after each treatment. So we basically tell people you're going to go through 90 days of treatments. And then from the last treatment, you will see your skin continue to improve and just look more and more beautiful for up to 6 months. I mean, it is truly amazing the regeneration of collagen and elastin that takes place as a result of these treatments. We hear all the time from people that like 4, 5, 6 months after they were done, their skin just continues to get better and better. I mean, it's an amazing transformation, truly. Post-treatment planning, these were pre-treatment instructions, and now post-treatment planning, some other things to think about. So I already said no sun for 2 weeks, so you really need to think about that after. Good idea to get a large brimmed hat that you love and wear it all the time, and wear sunblock whenever you leave the house for at least a few weeks. No other treatments to the same area, as already said, for 4 weeks. Stay on schedule. Keep the area clean after treatment. So we don't want you putting any makeup on the treated skin for a week. You could use like eye makeup for sure, but on the skin that we treated with the SkinTight, we really don't want you to put makeup on top of that until it's really nice and healed, usually about a week, maybe a little bit sooner. No hot tubs, pools, swimming, or sweaty exercise. Those are all situations that invite bacteria and can lead to potential infection. So we just want you to keep it clean for about a week. Doesn't mean you can't exercise, but we don't want you going to like a gym or, you know, getting into a really dirty, sweaty environment. That's the idea. Very important that you're going to follow the home care instructions that we give you and use those products. Don't exfoliate or use any medical grade skincare products for about a week afterwards. And do expect that your skin is going to be rough and flaky and a little sandpapery. There's no major peeling. There's no major downtime. It's very, very livable, but your skin's going to feel rough and, you know, not be its freshest or looking great for about a week. But nobody will know but you. We just like to prepare you so that you know it's normal. So the procedure itself, I already talked about the steps, so they're listed here again, but you should expect to be with us depending on how many areas you treat, and I'm going to talk about the areas in just a second. Typically, patients are with us for 2 to 4 hours, depending on the number of areas being treated. Like face and neck would be probably a 3-hour visit with us, for example. And like smaller areas like hands is going to be faster, face alone is going to be faster, you get the idea. But these are the steps. So you do get numbing cream applied to the area. That's the first thing we do when you arrive. We let you numb for about an hour. We then perform the VIVACE treatment, which is the radiofrequency and microneedling. We then perform the CoolPeel treatment, which is the laser on top. We then apply your topical platelet-rich fibrin matrix, the topical spun solution out of the blood draw, and then we send you home with your post-treatment home care. So that's pretty much the 5 steps. And then you return in 30 days and repeat. And you do a total of 3 treatments over a 90-day, ideally over a 90-day period. And by the way, we get this question a lot. Well, what if I can't come in every 30 days exactly, like I have something planned? No big deal. You can always go longer than 30 days. We do want to allow 30 days in between for proper healing before we do it again. But if you have to go a little bit longer between treatments, not the end of the world, not a big deal. So, but we do suggest trying to get through them all because you'll just get to your end point sooner and see your beautiful results. We like to do a final follow-up with you 90 days after your last or 3rd treatment. So that's the procedure. So are you a candidate? I basically just populated this webinar with a bunch of photographs to kind of use visuals to just highlight different things that can be treated very effectively with the SkinTight treatment. So this is a great picture of kind of a combination of where we would love to get her some tightening as well as some surface resurfacing. So this is a perfect call for the SkinTight treatment. I'm just going to keep going through pictures in consideration of time. But these are all really good examples of individuals who are great candidates for the treatment. So the reason she's a good candidate is she's got a number of great qualifications. So she's got this loose skin on her chin. Her jawline has lost its definition. So she's got a little bit of laxity on the jawline. Those things make us think of the skin tightening portion of VIVACE, right? The radiofrequency. She's got these etched lines in her skin. You can see a little bit of droopiness from her face, the sagging of the facial skin just dropping downward a little bit. Again, that sagging is VIVACE, and the etched lines in the surface are CoolPeel. So the combination of the two is really going to lift and tighten for the sagging part. And it's also, the CoolPeel part is going to resurface and retexturize the superficial surface of the skin. So great. This is could not be a better candidate for the combination of the treatments. I think you're going to get the idea as I go through this. This gal could use a little bit of firming and tightening on the jawline and neck. And she's got also some superficial fine lines, texture issues to the skin. So again, in this case, she might just want to treat her neck with the combination. That would be great. Whereas, by the way, I'm going to back up to this one. She really should do her face and neck because she's got the need for that lifting, tightening, and resurfacing on the face and also on the neck. So she'd be a good combination of face and neck. Here's another great example. Sorry for the resolution here. It's a little bit mottled on the screen, for me at least. But she still demonstrates being a great example. She's got loose skin on her neck. She's lost the definition on her jawline. So all of that would really suggest tightening and lifting. She's also got some heaviness here by her nasolabial fold, some this line called her marionette line here, which if we lift and tighten is going to really improve. And then I apologize because the resolution again is not great, but she's got some textural issues here that are really, really great for the CoolPeel resurfacing. So other thing I want to mention with like this picture and some of the other pictures coming through, some of you might be wondering, like, you know, wouldn't you treat this line, this marionette line, or this nasolabial fold with fillers? And yes, we would. A patient like this, and many of our patients also get Juvederm with SkinTight treatments. So yet another addition to the combination therapy. And so oftentimes that is a third component to the treatment that we go ahead and add in to get the best results. So sidebar, but we get that question a lot, so I just wanted to address it proactively. This is a great example of a great candidate for the SkinTight combination. She's got some pretty deep etched lines. So we really need to go deep to treat deep things. So the VIVACE portion of the SkinTight is going to microneedle this and deliver that energy to really tighten things up and produce deeper collagen and elastin. But she's also got a lot of superficial texture concerns here, which we're going to want to treat with that laser. So again, I just love this picture because it is just everything about the SkinTight procedure all in one. Another one, I'm not going to go through the detail anymore because I think you're probably getting the idea, but these are all really great candidates. So if you can identify with any of the conditions you see in any of these pictures, that would be a good indication that you're probably a very good candidate. So here are some before and after pictures to show you after results. So these are radial lip lines, or smoker's lines, as some people call them. Great way to treat them with these technologies, really wonderful results. This is a gentleman with acne scarring. And so I didn't talk about acne scarring too much. Most of the pictures I just showed you were more sagging lines and wrinkles, but I just wanted to include a picture here to show you how well these technologies also work for people with acne scars. This is a chest that shows some texture and pigment and just general aged looking skin and how it really freshens things up and clears the tone as well as smooths the texture. This is a great picture of somebody who could use jawline tightening, neck tightening, as well as you can see that the texture of her skin, the quality of her skin looks much improved after getting the treatment. Younger patient, but still we treat younger patients as well who want to get ahead of some of the aging they're starting to see. And you can just really see how she was beginning to form some lines and wrinkles around the lower face and how it just really smoothed and tightened. It's another great picture. This gal has those deeply etched. We see a lot of our patients with these, especially people who have spent a lot of time in Florida in the sun. And with one series of 3, you can really see how it improved the quality of her skin. Is it perfect? No, it's much improved. And I just made the reference to one series of 3 to say that, by the way, there's no limit to how many series of 3 you can get. This patient could, if she wanted to, undergo another series of 3 to get further improvement, just FYI. But you can see the really nice improvement that came with just 1 series of 3. This is just a close-up picture, obviously, of under the eye to show how it can really smooth some of the fine lines, wrinkles, and crepiness under the skin, under the eye. This patient, great example of neck tightening, jawline tightening, overall resurfacing, smoothing the quality and texture of her skin. She just looks fresher. Her skin looks fresher, more youthful, and everything just looks tighter and fresher. Great example. Then this is that same patient I showed you in the before in the Are You a Candidate, but it just shows the results afterwards, the kind of results you can get with these treatments on the neck. And there's the same patient I showed you earlier and the kind of results you can get on face and neck. So really nice improvement in the quality of her skin and the tightening. And I really like this picture too. This is something we got from the company actually that produces the technology, but just to show you, like, these are some pretty significant etched lines, lots of sun damage. This is after a series of 3. So you can really see how much improvement you can get in a series of 3. Let's go ahead and I'm going to click on the Q&A box. This would be a great time for any of you who have not yet submitted questions to go ahead and submit them in the Q&A box at the top or bottom of your screen. And for the next couple minutes, we'll walk through the questions that you have submitted. So let me take a look here. So question number 1, one of our guests says she is particularly interested in hand rejuvenation. And I did have hand pricing on that slide, but hand rejuvenation with the SkinTight procedure is absolutely amazing, honestly. If you have concerns with crepey skin, loose skin, texture, or even a little bit of pigment on the surface of your hands, we treat hands and it is a beautiful treatment. Same protocol that you heard me talk about, same 5 steps. We do everything the same. We just do it on your hands. And by the way, a lot of our patients add hands to other areas just because you can do it all at the same time. So just to let you know that. So thank you for that question. That was a great question. I see another question that I think I already answered. Do the treatments that I showed pictures of also include Botox and Juvederm? Many of them do. It's just each individual honestly varies from person to person. Some people will really benefit from Botox and Juvederm in addition, but some don't need it. So just variable from person to person. But I would say a lot of our patients who have the need for lifting and tightening, there is often a need for fillers as well. So when you do your consultation, that's something we automatically talk about. So great question. Another question here, can I still get Botox? Yes, absolutely. The only thing we need to do is you just don't want to get Botox same day. We never do it on the same day as these treatments because Botox and heat do not play well together. It is believed that Botox won't work as well if it's injected on the same day as another treatment with heat. So we avoid that. We also don't want to inject Botox when your skin is irritated or swollen or any of that. So we usually wait until the skin is settled down and pretty much back to normal before we inject Botox in an area that has been treated with these technologies. But absolutely, Botox is part of most people's ongoing maintenance and it fits really well with SkinTight treatments. Another question, let me see. I know with VIVACE, I did face, neck, and chest. Can this procedure be performed on face, neck, and chest? Great question. And absolutely, this procedure can be performed on face, neck, and chest. Yep. The only consideration we have to make with those 3 areas is the numbing cream that we use is pretty strong, and we can't numb 3 areas in the same day. So you probably experienced that when you got your VIVACE, but we have to split the areas into the most areas we can numb in one day is 2. So when people do face, neck, and chest, we usually do face and neck in one day and chest on another day, just so that you don't have too much exposure to lidocaine or the numbing agents in that cream all in one day. Great questions. Thank you so much. Let me see if we'll take maybe one more. Would this treatment be good for an adult with acne scars? Yes, I had put a slide up there of one example of acne scars, but this is an outstanding treatment for acne scars, honestly. So simple answer there, it's ideal. It would be definitely a series of 3, and depending on the severity of the acne scars, after 3, some of our patients even need additional treatments, but 3 for most people is a great corrective treatment protocol. And let me see what time it is. I think I'll take one more question and then we'll wrap it up. There is a question here that says, will this procedure address pigment? It does to some extent address pigment, no question. However, when we do a consultation with you, if we see that you have a significant amount of pigment, I mean, if there are lots of brown spots and pigment is one of your primary concerns, we usually like to talk to you about a different laser called IPL, which is a pigment laser. So it kind of depends on how much pigment we're talking about. If it's kind of a mild amount of pigment, maybe mild to moderate, you're going to get really nice clearing from the SkinTight procedure from just that alone. But if you really want your pigment to be gone and you have a lot of it, we often will incorporate another laser. Sometimes in addition to the SkinTight, we will do an IPL series as well. So again, that's kind of a custom discussion and we'll talk about it in a consultation. So I think we will wrap it up now. Thank you so very much for your attention and your attendance today. We really do appreciate you taking the time out of your busy day to learn about this very exciting procedure. The last slide I've got here basically is just to let you know how to contact us if you do decide to take next steps. This is our care coordinator email. If you send an email to radiance@radiancemedspa.com, our care coordinator team will promptly respond and help you book a consultation. You can obviously call us anytime. And we are going to send you a follow-up email as a result of your attendance in this webinar today. And that email will also provide links to how to contact us just to make it easy for you. So please reach out to us with any questions or to book next steps. And again, thank you so very much for attending today. We really appreciate your interest in this amazing new procedure. Thanks so much and have a great rest of your day. Bye-bye.